if you make a tooth look like it's not dead, but it is in fact dead, it doesn't make it healthy. It's like a corpse that you've dressed up for the open casket funeral, and they look really nice, it's like, oh, there's grandma. But in fact, like that's a dead person. That is not health. That is about as far away from health as you can make it.
On today's episode of the Modern Vital Podcast, we're going to talk about environmental factors and specifically toxicity in dental health. And we're going to be speaking today with a very special guest, Dr. Kelly J. Blodgett, integrative biological dentist. Dr. Blodgett's been redefining the modern dental experience to one that is a 100% positive experience for his clients. Over the past 23 years, he's created a Portland, Oregon-based practice, Blodgett Dental Care, recognized as an international destination for integrative biological dentistry and dental tourism. And he attracts people who seek a holistic and biological approach to their oral and whole body health. Through his weekly Toxic Tuesday and Wellness Wednesday social media posts, I highly recommend them, Dr. Blodgett shares truths not commonly discussed in a traditional dental setting. And his posts really illustrate the incredible journeys that his patients take back to health, along with providing best practices for predictable oral and systemic health. Welcome to the show, Dr. Blodgett.
Thank you so much. I'm thrilled. I love that we live in the same town too. It's like, what a hoot. This should be a great, great time today.
It's great to have you. So toxicity. So, you've been doing this for 23 years. And, when you're approaching someone's mouth, someone's, oral cavity, and looking at the microbiome, all the things, what are you looking for when you're looking, when you're assessing, and then particularly with regard to toxicity?
What I've come to focus on is their health story, like kind of the wholeness of their life's health journey. And it's amazing as we sit with patients during their new patient experience, how as they are telling their tale of like when did their health take a turn for the worse, how frequently we see that dental procedures were involved just prior to the shift in health. And as you so beautifully state in your book, the law of disease, toxicity is like number one. And you look at all the things of toxicity or the things in dentistry that present risk for toxicity. Mercury, it's been around for 200 years, highly toxic. Fluoride. The studies are plentiful showing lowered IQ as we get exposed to fluoride. Root canals, chronic infection through root canals, not to mention all the mixed metals we've been putting in people's heads for years. So yeah, it's abundant.
Wow, that's incredible. So, I was reading through some of your posts recently, and you were talking about how anaerobic bacteria will drain, through the lymphatic system, through the jawbone in particular, and then into the lymphatic system. And we know that bacteria do that, but do mercury and fluoride and these other elements, even maybe byproducts from candida or other pathogenic microbes, does that also go through that same system in the body?
Yeah, it kind of depends on the means of exposure. So I think, let's take mercury fillings just because it's so common. We know that at room temperature, let alone mouth temperature, which is, 98 degrees Fahrenheit, that's going to off gas. We breathe it in, we inhale it, and it also mixes with the food and saliva that goes down our GI tract. So like you've got through the lung tissue, through the GI absorption mechanism, like it's going to be absorbed one way or the other. Same thing with, you think about fluoride, it's like, it is true, in fact, that if you put acidulated fluoride on enamel, you'll make the enamel more resistant to acid. That's true. However, how do you do that without your oral mucosa rubbing up against it and absorbing all that fluoride? It's going to happen. So people go into the dentist by the millions, they put on the fluoride varnish, and then they go on about their merry way and they tell them, it'll rub off in a 24-hour period or whatever. Well, what it's rubbing off on is the underside of your tongue, the inside of your cheeks, and we absorb all that high parts per million fluoride. And then you've got, of course, like root canal treated teeth, which are like open sponges through which microbes crawl in and, get into the bone space. And then that's where your immune system starts raising its hand to say, hey, we're here to help out. We'll drain this stuff off. And unfortunately, it's like a chronically open valve or spigot for microbes to enter your body. It's crazy stuff.
Wow, that's fascinating because I mean we talk a lot about the the intestinal barrier, we talk about the blood-brain barrier, but what
Yep.
about the dental barrier? Where
It,
stuff is coming
yep.
in through and which is really the beginning of the stomach. I mean, the stomach is from the mouth to the anus,
Yeah.
and nobody talks about that.
Isn't that interesting? And yeah, I mean, you know how like that phrase leaky gut syndrome has been so popular? It's like it dawned on me a few years back, like, what about leaky gum syndrome? Which arguably the dental profession has been really, I would say, on the pro health side of things as it relates to gum inflammation, because we know, microbes that enter our bodies through our inflamed gums present health risks. But for some odd reason, like the profession doesn't look at how root canal treated teeth are equally these open pores, for lack of a better term, through which microbes enter the body. I've sent hundreds of extracted roots to a DNA lab in Colorado to have them analyzed. I've yet to see a root canal treated tooth come back that wasn't loaded with microbes. And it doesn't matter if it was in the mouth for 2 months or 20 years, they all come back loaded with microbes, which absolutely, for those who want to stand by the argument that, oh, well, the mouth's supposed to be full of microbes, I completely agree with that. But inside your teeth and inside your jawbone is not an appropriate place for microbes to be living. So, and that's exactly what happens when we do root canal therapy on teeth.
Wow, that's really fascinating. And naturopathic doctors have been kind of obsessed with SIBO for maybe 15 years now. And even though we've been treating it for 100 years, it just has a different name. And of course, people are more sick than ever before, so it is more serious, perhaps in certain ways. Anyway, we don't really talk much about the microbiome of the mouth, and whether there's maybe a SIBO of the mouth, for lack of a better terminology. I mean, obviously,
Yep.
SIBO, small intestinal bacterial overgrowth, but we know
Yep.
there can be overgrowth of candida. We know that candida ends up in the gut and it literally drives intestinal permeability. And it can actually almost co-sponsor autoimmune disease. It can actually, there's evidence now among the best scientists in the world. We're talking the best chronic infection and autoimmune experts in the world, PhDs who've been doing this for 40 years at the top universities. And they found that candida can literally cause celiac disease by making the gut more sensitive to gluten, and then gluten can kind of ride shotgun with these little hyphae, these little single-celled fungus that basically can kind of open up the gut. But what's going on in the mouth when that's happening?
Right. Gosh, I mean, if you look at the social trends, shall we say, over the last 100 years of let's antiseptic everything, like let's get you on Paradex rinse and kill everything in your mouth, or it's like been this fear of let's instigate fear of microbes anywhere. And it's like, well, I don't think that sterilizing the mouth, or even I hear this all the time. We have, people call up and they say, hey, I'd like to replace my root canal tooth with an implant, a ceramic implant. The dentist that I'm seeing in Dallas, Texas, let's say, is telling me that I have to take antibiotics to do that. Or to get my teeth extracted, they want me to take antibiotics for a week. This isn't like a one off. This is unfortunately it's the status quo. And I think rightfully so, a lot of dental providers are kind of medico-legally scared that, if a patient gets an infection subsequent to treatment, that they're going to get sued or something. And unfortunately, there's just so much overprescribing of antibiotics still in dentistry. I'd like to think that that's improving, but geez Louise, over the last half a century at least, over by and large, like we're really negatively impacting people's oral and total GI microbiome because of the types of antibiotic and antiseptic practices. It's really unfortunate. And I love what you're talking about like, why are we in fact seeing human beings experiencing these states of hyper-activated, immune systems? It makes no sense at all from a biological standpoint. But when you look at what we're doing to people, it actually makes a lot of sense.
So you're basically talking about how many of the conventional practices can kind of open the gates to increased toxicity, inflammation, and susceptibility to chronic infection. And it sounds like you're seeing that all the time, all day in your
Yeah,
practice.
absolutely. Absolutely. And I mean, it's unfortunately because so many people who are suffering manifestations of oral disease or root causes in the mouth, but their symptoms are being expressed in their joints or their skin or something that's distant from the mouth. It oftentimes takes people a long time to kind of put the pieces together, and then it's even worse when they go to their dentist and say, hey, I think this is going on and my root canal or my titanium implant is negatively impacting my health, and they're met with like, oh no, that's not possible. And it's like, oh boy, these poor people. It's what I refer to as the dental dilemma. It's like your dentistry is making you sick, and to make it matters worse, your dentist tells you that's not possible. So it's a real conundrum for people who are suffering.
Yeah, I mean, I see it in my practice all the time. People say they've got a reinfected, root canal, and
Yeah.
they're about to go to their dentist. What do you do for that?
Well, I was just answering an email to a patient out of state this morning about that exact same thing, where we're talking about if you make a tooth look like it's not dead, but it is in fact dead, it doesn't make it healthy. It's like a corpse that you've dressed up for the open casket funeral, and they look really nice, it's like, oh, there's grandma. But in fact, like that's a dead person. That is not health. That is about as far away from health as you can make it. And we've been doing this now for almost 100 years and telling people, oh, yeah, with this dead organ that's connected to your jawbone, you're totally fine. Not only are you fine, there's no way that that can make you sick. My clinical observation and my scientific experimentation in terms of gathering information from DNA samples is completely the opposite. That in fact, dead teeth are what we might think they would be. I mean, they're the risks, massive risks to people's health. I hope that the profession, in time starts to really take a serious look at what are we telling people? Is it accurate to tell somebody that they can have a dead tooth in their attached to their jawbone and we call it healthy? My opinion would be no, that's not appropriate, but that's unfortunately not the stance of the profession at the moment.
So do you go in there then and remove that for them, and then put a new one in there that's made from the materials that you synthesize or that you in your lab, or?
Yeah, it just it kind of depends on that person. The first step would be like, let's remove the source of toxicity. So whether they choose to then replace the tooth or not would be a personal decision. My first and foremost goal would be let's help you heal well, regardless of which way you either do or don't replace the tooth. Let's get your biological balance back and your energetic flow back. And then if they want to replace it with either a bridge or a ceramic implant or even a removable partial denture. I mean, they could. There's a lot of options, right? And basically, we get to the solution of what's best for you by asking, all right, 10 years, 20 years from now, what kind of oral health would you like? How would you like to chew? What are your budget? What's your timeline? Go through things like that so that we can develop solutions that respect their goals and their autonomy. It just fits the bill for that patient, basically.
I know you use a lot of ozone in your practice. I'm trained in ozone as well. Do you actually inject some ozone down into that area where you've got that dark colored anaerobic bacteria, or
Yeah, yeah,
you do?
absolutely. It's a big part of our protocol, using ozone and lasers, and also like using people's own healing cells by doing blood draws and what's called LPRF, like using their immune cells and their clotting factors to help their body expedite healing. It's just awesome, awesome use of your own healing power.
So you're basically saying that this is a window into increased toxicity. I mean, just this piece right here, basically these dead teeth
Yeah.
are setting one up to be more liable or susceptible to something, whatever comes their way, maybe.
Absolutely. So, and it's twofold in my opinion. I mean, one, you have like frank exposure to microbes in an area where you should not have it. Secondarily, you also have, it's just like putting a resistor into an electrical circuit. That tooth, which used to have energetic flow through its own nerve supply and blood supply, You remove that, and now it's like a resistor in that circuit, which we understand from Chinese medicine that that's not going to work. Every organ that's connected to that meridian is now going to be at a risk of experiencing that decreased energetic flow as well.
So where can people find you, Dr. Blodgett?
Yeah, please. They can go to my website, which is blodgettdentalcare.com. And certainly they can find me on social media. My Instagram handle is at Blodgett Dental Care. Same thing on Facebook. They can look up Blodgett Dental Care. And this year I'll be heading out to 8 different cities across the country to do the second iteration of my Toxic Tooth Tour. My goal is to help inform and inspire and educate people about the risks that traditional dentistry presents to their health, the kinds of toxicity that would expose them to, and then what they can do about that if they've had mercury fillings or root canals or metal implants. So I really hope to shine a light on how people can experience better health by creating a biological and energetic balance in their mouth.
Oh, that's phenomenal. Well, thank you so much for joining us today. That concludes today's episode of the Modern Vital Podcast. We'd love to hear from you, and we value your feedback. If you have any questions or suggestions, please reach out to me at ben@modernvital.com. Also, please leave us a review if you enjoyed this episode, and we look forward to having you join us next week for another exciting episode of the Modern Vital Podcast. And that's a wrap for today's episode of the Modern Vital Podcast. Your support fuels our mission to empower you on your quest for optimal health. Remember, our Modern Vital store offers supplements to guide you on your path to wellness. And don't forget to subscribe, leave a review, and share our podcast. Until next time, stay proactive on your health and wellness journey.